Well, hi everybody. Today I'm going to tell you about a topic which I think is quite interesting, namely the evolution of medical technology and how it could benefit us transsexual people. So, this blog is going to contain some speculation about future possibilities that medical technology will offer us as it keeps evolving. Um, so, this will be maybe a bit of science fiction. Some of the things I'm going to talk about are very far from being possible right now, and other things are actually close to becoming a reality. Okay, so I'm going to begin by talking a little bit about SRS and what we have now. Um, well, SRS was first performed apparently in Germany in the 1930s. Um, at the time, the procedure was very basic, right? So I'm pretty sure the first sexual reassignment surgery involved, removing the testicles and pretty much, carving a hole inside the patient's body, which was probably not very realistic looking. But the surgery has evolved very much over the years, and now, if you look at pictures of the work performed by Dr. Suporn, for example, in Thailand, you can see that the results are extremely convincing. You just can't tell by looking at the external genitalia that this is the result of a sex change. Um, We also have many more surgical options than in the past. We have breast augmentations, butt and hip implants, facial feminization, and even voice surgery now. So, as medical surgery evolved, we've been able to get more and more feminine, more and more options to feminize our bodies, in addition to hormones. I think, however, it's fair to say that most of what we have as trans people was not developed explicitly for trans people. Obviously, when you think of SRS, which is the transsexual surgery, that was developed for trans people. But the medication we take, for example, hormones like Premarin, they were not developed for transsexuals. First, they were created for menopaused women, who wanted to avoid the negative effects of menopause. Breast augmentations were not created for transsexuals, they were created for women who wanted to have bigger breasts, and it just so happens that it's very beneficial to us too, so we can benefit from that. Facial feminization, well, facial feminization is a bunch of surgical procedures, you know, that come from the world of plastic surgery. And in a way, you could say it's designed for transsexual people, but plastic surgery as a field, evolved mostly because of women who are afraid to face aging, and also because some people absolutely need reconstructive surgery, for example, after an accident. Um, and well, in terms of medications, there's also the anti-androgens, Um, pretty much all of the anti-androgens that we have were developed for prostate cancer. You know, Casodex, the one I'm taking now, is prescribed to prostate cancer patients to minimize prostate enlargement. The same thing is true for spironolactone, although spironolactone was originally designed for people with heart conditions, and the same thing is true for Androcure. It's also prescribed to prostate cancer patients. I mean, the reality is transsexuals are a very small segment of the population, so the medical world, we can't really count on them, I think, to develop much technologies for transsexual people. That being said, I think that as medical technology keeps evolving, there will be many more possibilities for us that will possibly make our transition, even better in the long term. Because what we have now as transsexuals in terms of medical technology, involves many compromises. In the end, we can hope to have a female-looking body that's hopefully convincing, passable, but that seems to not always be possible. What we get in the end is not perfect. Um, Male to female transsexuals can't carry a baby in the end. We don't have a uterus. The surgery that we get is risky and it's costly. Of course, it has all the risks of any surgical procedure, but there's also the fact, for example, that SRS has the risk that you may not be able to have an orgasm after, which is a big deal to many people. And SRS, it's an aesthetic procedure. You get it and you hope that you'll have a very natural looking vagina, but it's not the real thing in a sense. The vagina that you'll get, you won't be able to lubricate during sexual relationship. You don't have the same muscle structure in there as a genetic girl does. So it's not perfect, obviously. The medication that we take is also not perfect. It has side effects, and products like anti-androgens developed for prostate cancer patients, they were not developed to be taken for decades or for a lifetime. They were developed to be taken for a certain period of time, a certain number of months, a few years, but not forever, and the side effects can be very annoying. But hopefully, medical technology keeps progressing, and there's many exciting possibilities. I've heard recently that some doctors have started screening women for womb transplantations. So apparently, women that are sterile in a few years may be able to get a womb transplant from a presumably dead patient and carry a baby again. So that's very interesting because it's possible that if this works for women, it could also work for transsexuals. In fact, I think it's very likely that if they can make it work for women, they can make it work for transsexuals as well. Fortunately, this procedure is complex and there are risks because, as most of you know, when you transplant an organ, there's a risk of rejection. So that means your own immune system can attack the organ that was transplanted because your body doesn't recognize it as its own. It recognizes this organ as being foreign, as being a foreign body that's been implanted into you, and then your immune system attacks it, and that can make you sick and can make you possibly die. So you have to take anti-rejection medication for life. So people were saying, well, if women get womb transplantations, they would presumably have to take anti-rejection medication for as long as they intend to keep the uterus, and then possibly have the uterus removed after they're done carrying the baby. But then there's other complications because apparently anti-rejection medication can provoke deformities in a gestating baby. So this kind of possibility, seems like it could happen soon, but they aren't quite there yet. They haven't fixed all the problems. There's other interesting possibilities in the medical world that are, potentially coming soon in the next decades. I'm sure all of you have heard on TV about stem cell research, and possibly even about organ cloning and all the controversy about stem cell research. But basically, one of the most interesting possibilities, I think, of stem cells is that it might be possible to use stem cells with your own DNA in them to basically clone an organ that has the same DNA as you. So, for example, we could, clone your heart, make a copy of your heart with the same DNA as your own. If your heart was going to fail, then replace your heart with this copy, and then there would be no rejection. You wouldn't have to take anti-rejection medication, and it would reduce the risks a lot, and also eliminates the supply problem. If we can clone your heart in a reasonable amount of time, then we don't have to hope that there will be someone that can give an organ, with a compatible blood type and everything. We can just make it, and so that's very interesting. But for us transsexuals, what's also interesting is that it may be possible to clone a uterus with your own DNA in it, and even clone ovaries and female genitalia, and then transplant those organs into your body that would have your own DNA, that would not be rejected, and that would possibly allow you to carry a child that would even be genetically yours. And there's even a bonus with that. If we could transplant ovaries with your own DNA, you wouldn't have to take hormones anymore, for example, And here I'm talking about this from an MTF perspective, but the same applies for FTMs. If we could clone male genitalia and testicles for you, you might be able to father a child that's genetically your own and not have any risk of rejection and not have to take testosterone injections, So this is a very exciting possibility that might happen in the next decades. Now, some of you might be a bit puzzled here because I said cloning your uterus with your DNA, but then if you're transsexuals and you have an X and a Y chromosome, you don't have DNA with two X's, so you can't clone an organ that has female DNA in it. This is not as much of a problem as it sounds, because it might be possible to just, create a stem cell and then use two X's from two of your cells to create essentially a stem cell, your DNA minus the Y. That would essentially be like a female version of your DNA. And if you're an FTM, it might be possible to take the Y chromosome from one of your brothers or from your father, and then create a male version of your own DNA and avoid the whole rejection problem once again. Because even if the DNA is not exactly yours, we can possibly manipulate the cell markers and again make them compatible with your immune system. So that's a very exciting possibility. It might make transition much better for a lot of people, but of course, it's not perfect. It's another surgical procedure that we add to the set of tools that we have. But even farther into the future, I think this is the dream of many transsexuals, that someday we might be able to clone you a whole new body. The fact is, people don't like dying, and people have been dreaming for years, that maybe we could clone your body when you're old and then transplant your brain into this new body, and then you could keep on living, possibly forever like this. Well, the interesting aspect of this is that if we could clone your body and transplant your brain into it, why not clone a female version of your body with female DNA, and then you'd be transplanted into a perfect, young, healthy female body. It would be just one surgical procedure. You wouldn't need to take hormones after that, and you could possibly live a very happy life, with everything you ever wanted to have in a female body, and it would probably simplify transition for a lot of people and give you the perfect results you always hoped for. Obviously, this is very far in to the future. It sounds like science fiction. I think cloning a human body is not that far from what we can do. Obviously, there's a moral dilemma here. Whoa, you're gonna clone a body and put your brain into it. What do you do with the brain that the body had already? Well, what people have been suggesting is that we might be able to clone a body without a brain, therefore completely avoiding that kind of a moral dilemma. Still, it's not obvious that people will accept the idea of cloning right away or ever even, but I think there's a fair chance that they will, because I think people are very attracted to the possibility of being able to live indefinitely. So this kind of technology, might come to be very much wanted by the general population in the future. But then, of course, I've talked about cloning a human body, which I don't think is very far from reality. But transplanting a brain is actually something that's medically very complex, because, well, transplanting a heart, the fact is you can take the heart out of a human body, put it into ice, and it's going to be able to survive for a couple of hours. So that makes this surgery relatively feasible. The problem with transplanting a human brain, however, or one of the problems, is that the human brain, if it's without oxygen for something like 5 or 6 minutes, it will begin to sustain brain damage. So this means that if a brain was to be transplanted, there would have to be a way to maintain a constant oxygen supply to the brain while it's being transplanted. And we can imagine that this kind of procedure would take hours. So that's one difficulty in here, which I think is not impossible to face. Another difficulty, however, is that the brain is a very sensitive organ. So if it was to be transplanted, it would have to be manipulated extremely delicately, because just manipulating your brain, it's possible it could be damaged. Yet again, another difficulty here, and I think this is the biggest one, is that the human brain is connected to your spinal cord and to your eye's 3D optic nerve by millions of nerve fibers. And I mean millions. So if you're going to cut those nerve fibers to transplant them into a new body, you need to be able to reconnect them to the new body. And you need to be able to reconnect them properly, in the right places. And this is much beyond what we can do now. We just don't have the tools, don't have the accuracy to be able to do that. So I think that's the major roadblock to something like a brain transplantation. And well, simply put, I don't think that brain transplantations will be performed by human if they are ever to be performed. We're going to need some kind of very accurate surgical robots to perform this kind of work, to reconnect every single nerve fibers in the right place, and make sure that everything is done with extremely precise, extremely accurate movements, and that the brain is not damaged in any way, that everything is done right. That being said, I don't think that there's any limit in this physical world that could prevent us from doing it. If we can develop robots that are precise enough, if we can develop the right tools to do this, then someday in the future it might be possible. And it's a very interesting possibility, because if we can transplant a human brain, then it could mean, no matter your age, even if you're 60, you could get transplanted into a body, that's 18 years old, and begin living your life as a female, and you would be like new, you would get a new life, and you would be passable, from the get-go. And that's a wonderful possibility, I think. Not to have to transition for years is also a very interesting possibility. That being said, it's very far into the future. We might need extremely accurate robots, much more advanced medical technology than we have now, and we might also need stem cell technology. I've heard that they've been doing research on using stem cells to reconnect the spinal cord in patients, so that could possibly be used for that. If we have to cut the nerve connection between the brain and the spinal cord, it's possible we'll need stem cells to do this. So what else can I talk about? That sounds like it's very far into the future. Well, personally, I'm not sure that body cloning and brain transplantation will ever be possible, for the reasons I mentioned. It's possible we'll never have surgical robots that are precise enough to be able to do this. It's possible we'll never be able to transplant a brain without killing it. But stem cell research has been progressing, and in addition to organ cloning, there's been research into using stem cells to perform regeneration. So as most of you probably know, there are animals out there, such as lizards, that when they get hurt, they don't scar, they regenerate. So this means you can cut the tail of some lizards, or even cut off the legs, and they will regrow a new tail and new legs. And the same goes for their internal organs. If you cut off a small bit of one of their organs and it's not lethal, then they will regrow this with no scars. So researchers have been researching this, because obviously, some people have to be amputated sometimes, and it would be very nice if humans could regrow limbs, So they've been doing research in mice, and have apparently succeeded at giving mice the ability to regenerate through an injection of stem cells. So the same thing could be eventually applied to humans. So why is that interesting for us transsexuals? How does it relate to us? Well, if we could clone stem cells with your DNA, or a female version of your DNA, and put them in your body, it's possible we could use those stem cells to grow, for example, a uterus inside of your body without any surgical procedure. It's possible that very far into the future, we could give you an injection and you would grow a uterus, and eventually perhaps even female genitalia, just from this injection, a single injection once, and then you 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 have the uterus. You don't have to take hormones, and you become fertile eventually. Of course, it's a little more complicated than I make it sound. Um, the most interesting thing would be to be able to have an injection that would, over time, transform you into a female with absolutely no surgery being necessary. You just give this transsexual person an injection, and they start changing sex progressively over time. Um, but this is not going to work, I think, just with stem cells. You might also need to use nanorobots. So if you've never heard of these, people have been speculating that very far into the future, it might be possible to create very small robots that are so small that they can fit into our blood circulation and basically perform surgeries at the cellular levels on our bodies. So I think this is very interesting because if we had those smart nanorobots that we could inject those into your body along with those new female stem cells, and those nanorobots would basically begin operating at the cellular level on your body to adjust everything. So over maybe a couple of months or a couple of years, you could have those robots, try to reshape your bones, to remove your excess body hair, and then to create a uterus. And basically, that's it. You would go through counselor, and at some point they would approve you for a sex change. They would give you this injection, and all you would have to do is wait, and would progressively turn into a female. So this goes much beyond body cloning. It removes the complexities of surgery. But not only that, if we had nanorobots that can constantly operate on you at the cellular level, it's possible that we could cure aging. When those nanorobots notice that some of your cells are too old, they could replace them with brand new stem cells, and then you just wouldn't age, you would always remain young and healthy. So this is extremely far into the future, I think, but still, stem cell research is progressing very fast, and things like regeneration in humans might actually happen in the next decades. As I've said, they've been able to do it in mice. They've been able to make mice regrow new limbs. And I don't mean that they've genetically altered these mice. Those were normal mice that received an injection of modified stem cells and then gained this regeneration capability for a few months. So if we can do that to humans, then all of a sudden, those possibilities I'm talking about, like receiving an injection to grow a uterus, don't sound so far-fetched. As for nanorobots, well, they're still pretty far-fetched, but there's ongoing research about that too, and it's very possible it will succeed someday, because when you think about it, nanorobots kind of exist in nature. Your immune system has those cells that will attack foreign bodies that are kind of like nanorobots, nature's nanorobots that circulate in your bloodstream and perform some tasks to protect your body. So maybe in the future we'll succeed at overcoming those roadblocks and having some very advanced medical technology that benefits not only the overall population, maybe we'll cure aging someday, but maybe we'll also be able to use this technology to make transition much easier and much more compromise-free for us transsexuals. So I think this is very exciting. And yeah, womb transplantations I think are not very far. And not only that, I've also seen an interview by Dr. Brassard, I believe, here in Montreal, a doctor who performs SRS, who said he actually had some ideas for possibly even constructing an artificial womb for transsexual women. So I think that there's some very interesting possibilities for us in the future, and hopefully we'll live long enough to see them and to benefit from them. So that's it. I hope you found this subject interesting. So have a nice day.